That's great. I always love a round of applause before I even say anything. It means I'm looking sharp tonight. Thank you all for coming. Just as Jeremy started his talk by sort of talking about our students and thinking about that next generation, tonight I'm actually filling in for one of our students because I'm speaking about her dissertation work, and this is Esther Min, who's with us tonight. This is very much a project that started under her leadership. She brought us together with a bunch of community partners to make it possible to map environmental risks within the state. And so thank you, Esther, for allowing me to talk about your work tonight. So when I think about health and environmental health, I'm pretty selfish. I think about my own health, and I've pretty much given up on my own health. And so I think about the next generation, which is my daughter, who also is with us tonight. And when I think about her health, she's an only child. And so, me and my wife give her a lot of attention. And we think about sort of this trajectory. And, maybe for some of you who are parents or who think about your parents and health, you understand this. As we sort of age and we go through life, we're exposed to a million different things as individuals, and we struggle as individuals to kind of deal with health, whether it's trying to get enough exercise or eat the right foods or deal with stress, make ends meet, have a nice livable work, and then having access to clean air, water, and soil. And these are just sort of fundamental things that we strive for as individuals to live a healthy life. But that said, sometimes there are things that are sort of larger than the individual. And that's where we as public health scientists think about the health of our populations and our communities. And just thinking about what Jeremy mentioned earlier about climate change. And we don't need to see charts and tables and whatnot to understand that climate change is starting to impact our day-to-day lives. And I'm sure many of you remembered last year when literally, because of the wildfires, we had ash falling out of the sky. And the concentrations of PM 2.5 in Seattle were worse than they were in China or in India for that 1 week. And so again, these are shared risks that not just individuals face, but entire communities, our entire region faces. And so what do we do about this? And thinking back about those individual level risks about diet and food. If you see your doctor and your doctor asks, "Are you getting enough exercise? You're eating well?" You know the answers to those questions. You may not tell your doctor the truth, but you know. But if I ask you that question about, what your air quality is like today compared to, the neighborhood down the street? Do you know how many solid waste facilities, hazardous waste sites are in your community? Next to the school where your children are running around and playing? Do you know the answers to those? Those are community level, neighborhood level questions. And I suspect that many of us in this room don't know the answers to those questions. And that's a problem. And so about a year and a half ago, we embarked on this partnership to develop a mapping tool, which would improve our understanding of neighborhood and community level risks. And this is the Washington Environmental Health Disparities Map. And you could see the partners here, notably Front and Centered. It's a local environmental justice organization. Worked very closely with us on developing this, and in particular, having us think about the diversity of communities that exist across Washington State, and how do we represent that diversity in thinking about environmental risks. I should also mention Department of Health. They're also key partners in the development of this mapping tool. And I'll show you some examples later. So how do we look at diversity? How do we think about environmental risks across Washington State, which You know, the east side's different from the west side. The urban communities are different from the rural communities. And then the people are obviously very different in these different places. So Esther went out to 11 of these communities and held listening sessions. She actually sat down with folks and asked them, what is it like to live in your community? What are the environmental hazards that you face, and how do you deal with them? What are you worried about? How does it affect your health? And those questions helped inform our understanding of thinking about what sorts of factors to map for the state. And what emerged from these conversations with residents in these different communities is sort of represented here in these word maps. And you could see the traditional environmental risk factors, things like we worry about air quality, we worry about pesticides, we worry about clean water, traffic. But you also see some other things, some things about how people express their vulnerability to these hazards. I can't deal with air pollution because I have asthma. It's worse for me because of that. Or I don't speak English well. And so I don't understand, you know, when I go to a website and it's all in English and there may be information there that could be very helpful for me to know, to manage my environmental threats, but I can't read it because I have linguistic isolation. And you can see some quotes here, which are also indicative of just how complex environmental risks are within our communities. One quote talks about red tides or algal blooms and how they definitely affect our fish and shellfish. So algal blooms are related to climate change, related to water quality. Fish and shellfish are related to things that we consume, but also our livelihoods if we work in these industries. And so these things they don't act alone, but they act cumulatively, and they interact with one another. And similarly, a child spoke about her mom who works in agriculture, and in the fields she's exposed to pesticides. And because of that pesticide exposure, she has asthma. It makes her asthma symptoms worse. And so it's work, it's chemicals, it's the kind of work that's being done and her exposure. And she also mentions being exposed to wood smoke and wildfire smoke when she's out working. So it's a culmination of many of these different things. And so we need to reflect that in our mapping of the state. We came up with this simple color coding scheme, whereas if you're red in this color gradient, it means you're within the 10% highest impact community in the state, okay? And based on that ranking, we can create these maps for the state. And this is a live tool right now that's running on the Department of Health's website, where you can zero in on the community that you live in, and you can try and understand what it is that makes it either a red or a blue or somewhere in between. I'll give you an example. This is Pierce County. And if you look at one of the census tracts in Pierce County, it's ranked 10. It's a highly impacted community. So, you know, the way that you should think about using this tool is not that, wow, this is a red community, this is a highly impacted community. That's really awful. But rather, we should try and dig into this community and try and understand what makes it red. And when we do that, if you drill a little bit deeper, you can see that in terms of environmental exposures, what contributes to this community being ranked 10 is the fact that it has some of the highest diesel emissions in the state. That's something that we could work on, a concrete, objective measure that we should focus on to help people who live in this community. Let's look at a different community. Over in Yakima, this is another census tract. It's also a rank 10, but it's ranked 10 for a very different reason than what we saw in Pierce County, that census tract. So if you dig a little bit deeper, you'll see that some of the environmental exposures, one of the reasons why it's ranked 10 has to do with very high PM levels in the Yakima Valley. And so it helps us to understand specifics, because these are ways in which we could target solutions for these communities. And we're doing that. This isn't just an academic tool. Over the last year, we've seen a lot of policies and departments across the state adopt this tool as something to help communities. And so you could see the laundry list here. The Volkswagen diesel settlement, there's money there in the bank, in the state, that needs to be spent. And what better use of the mapping tool would it be to use the diesel money that's collected from VW, because they were polluting the environment, to target to solve environmental justice issues in our state. And similarly, if you look down at the bottom one, we have a new clean energy policy in this state as of last week. And in that bill, there's mention of using our mapping tool, again, to target solutions for environmental justice communities. So collectively, all our partners are looking forward for new ways to use our map to help drive solutions in communities. So this is a question for you all to think about. This is a public tool. It's available. The website's live. We're continually making improvements to add new data. How can it be useful in the kind of work that you do? We want to create better solutions. So I'm happy to talk to you more about some insights that you have in making this tool better and more useful for action. Thanks.